Welcome to Physio TV. Today we are going to discuss WorkCover Queensland, the role of physiotherapists when interacting with WorkCover, and how the competency domains of community rehabilitation would be affected in patients that are covered. First, we are going across to Timothy Wilson, who is an employee at WorkCover Queensland, to give us a brief introduction about WorkCover. WorkCover Queensland supplies workers' compensation for employees of Queensland businesses. It is mandatory for all Queensland businesses to cover employees. Workers' compensation is a type of insurance that can pay the wages and medical costs of employees who have been injured due to their employment. If an employee is injured at work or because of work, they may be eligible to claim benefits from WorkCover Queensland. Alternatively, they may be able to receive similar benefits from their employer if they are self-insured. WorkCover Queensland provide over 150,000 employers with compensation insurance coverage, manage 92,000 statutory claims and 4,000 common law claims per year. It has been recognised by the Royal Australasian College of Physicians that working results in significant health benefits and that being off work for long periods can significantly reduce the likelihood of a worker ever returning to work and can have a negative impact on the worker and their family. WorkCover Queensland are currently returning over 95% of workers to work at the time their claim closes. Injuries can happen at work, travelling to and from work, while on a break from work, or at home. Injuries can also take place if you are travelling for work or visiting other workplaces or sites for the purposes of your job. Examples of different types of injuries covered are physical injuries, psychiatric and psychological disorders, diseases, aggravation of a pre-existing condition, death from an injury or disease. When an employee makes a claim, information is gathered from the worker, employer, doctors and other people, such as witnesses to the event or independent medical examiners, to help them make a decision on whether it will be approved or not. Once WorkCover has gathered enough information to decide on the claim, both worker and employer will be informed on the decision. According to the Workers' Compensation and Rehabilitation Act 2003, employers have a responsibility to provide suitable duties. If an employer does not have suitable duties for their worker, a customer advisor will identify if a host employer is appropriate and return the worker to some sort of work this way until the worker can resume their original duties. Thanks for that, Timothy. We'll now cross over to Ashleigh Hamilton from APA to discuss how physios interact with WorkCover.
Thanks, Timothy. As physiotherapists, we're closely related to WorkCover and play an essential role in getting these patients back home or back to work following their injuries. During the time allocated to the patient, the physiotherapist may be involved with the rehabilitation coordinator, employers, allied health providers, and all other stakeholders. In particular, the customer advisor, who oversees the suitable duties plan, is the main point of contact for all liaising parties. During our time with the client, there is a responsibility to treat and manage the clinical care of the injury, make significant contributions on improving the health and return to work outcomes under the direction of the treating medical practitioner, and also give them an opportunity to develop a range of work skills in order to improve work fitness, build confidence, and re-enter the workforce with satisfactory skills. However, not anyone can become a WorkCover patient within the clinic. Individuals who fall into this category must hold a current medical certificate and been referred by one of the following: either WorkCover directly, the employer's rehabilitation and return to work coordinator, or 3, a medical practitioner. WorkCover will generally cover these patients for the time that they see necessary to resolve the injury. Therefore, time management and prioritising these patients is of utmost importance. If a worker is unable to return to their normal duties during or following our treatment, WorkCover will develop a suitable duties plan to help them stay at work and return as quickly as possible. These duties plan will take into account the employee's current capacity to work, the medical advice that we give and that other people give, and the individual's situation. So, what's our role as a physiotherapist? As physiotherapists, we aim to functionally retrain the individuals, focus on areas of achievement rather than dysfunction, and make recommendations for duties that are actually achievable for our patients. These outcomes are generally achieved by a standard physiotherapy assessment, followed by an emphasis on the importance of treatment and active rehabilitation, education around both the presenting condition and also a return to work, while emphasising that the best outcomes tend to arise when the individual is still able to work in some capacity. We're also responsible for identifying any risks that may hinder their recovery and return to work. Set realistic goals that focus on the worker and what they can do, not what they can't, and encourage, where appropriate, for the worker to self-manage their conditions. Unfortunately, we must target these based on the injury, meaning that they may not always return to their pre-injury function. Once each session is completed, we need to relay the information obtained, and this relates to any advice or feedback, both verbal or written, given regarding the worker's injury, the treatment approach, and return to work expectations, as well as any results from the initial assessment and follow-up assessments, including screenings and outcome measures, what treatment is planned, and the goals for both us and our patient, including return to work goals, whilst also providing an estimated timeframe for recovery and a pathway for how much treatment is anticipated. Information on all of these should be clear and detailed. WorkCover does, however, respect the confidentiality relationship with the client. Therefore, any information unrelated to work or the examination findings and prognosis of the injury is not essential to report. I'll now pass back to Timothy. Thank you.
Thanks, Ashleigh. We'll now cross to George Dooley, who is a community physiotherapist, who will discuss the competency domains of community rehab and how they relate to WorkCover.
Yeah, thanks for that, Tim. My name's George. I'm a community rehab physio, and we're going to be talking about the competency domains today, okay? So we know that they're critical to the development of a profession because they provide consistent recognition, accreditation, equitable assessment processes, articulated training and career progression within occupations. Competencies also define how practitioners are expected to assess, treat, and interact with consumers. They offer the potential to improve performance and outcomes by providing a platform for training and supervision of practitioners, as well as providing structure for recruitment and profiling of workforces. The Australian Physiotherapy Association Code of Conduct described physiotherapy as a holistic approach to the prevention and diagnosis of disorders of human movement to enhance the health and welfare of the community. All APA members are guided to work towards justice in the community, planning and implementation of services designed to provide optimum healthcare for the community. The APA has stated that the practice of physiotherapy is so extensive that competency standards are prepared for entry level only. Of the 10 competency domains of community rehab listed on the slide, the following have been noted of significant importance, particularly with respect to the consumer returning to work following injury. So number 2, we have consumer engagement. This focuses on the consumer as central to every process. Services are based on consumer needs, direct service provisions according to their preferences, choice, and options that are communicated clearly and understood. At all times, consumers are supported to engage in self-determined health behaviour. Number 3, we have the holistic approach. This competency domain involves using an inclusive approach to assessment and interactions with consumers that recognise situational, environmental, family, carer, and community influences on consumers and their preferences or needs. Number 4, we have service continuity. This competency domain is about providing continuity of services by supporting consumers through transitions, screening for risk, and intervening early to optimise long-term outcomes, following up and monitoring consumer progress over the long term and identifying gaps in the continuum. Finally, the 7th domain, community engagement. This competency domain incorporates all aspects of being in a community, engaging with local communities in a respectful and trusting way, involvement in local activities, recognising how individuals live and function within a community, appreciating a collective way of operating, and investing in the community. In 2006, the authors that published the competency domains of community rehab at Griffith University noted some limitations. I have a quote here. One of the main outcome measures for any tertiary rehab intervention is whether or not an individual has returned to productive activity, i.e. competitive employment, volunteer work or study, following an injury or illness. However, vocational outcomes and needs were rarely mentioned by practitioners as a feature of community rehab. The lack of data directly relating to the use of vocation services was significant, given the importance of productive activity to long-term independence and outcomes following injury. Some support personnel noted the fact that they often provided support to consumers within a work context to assist in the transition back to workplace. There is a need to examine the interface between these two sectors, particularly for consumers where motor vehicle accident or workplace injury was involved and the relevant vocational rehab systems would have been instigated. Several practitioners also noted that the community rehab domains left them unclear about when and how to disengage from consumers and the communities. Practitioners described that a boundary to carrying out the community rehab domains was a lack of distinction between community rehab and ongoing disability lifestyle support. And finally, I'll leave you with another quote from this publication. The current health and community care landscape emphasises the need for an effective workforce that is able to maximise consumer outcomes. If community rehab is to respond appropriately to the future needs of consumers and health professionals, it is necessary to review the competencies community rehab practitioners will require in order to do their work, and evaluate the competencies that are present in the current workforce. Training must be informed by these competencies and reflect preferred styles and methods of learning. The current education and training audit seeks to address these issues, using a collaborative and recursive approach to data collection. So that's just my thoughts on the matter, Tim. Thanks very much for having me, and I hope to be a part of future shows. Have a good one.
Thanks for that, George. Based on what we have seen so far, and along with an examination of the literature, it has been found that most physiotherapists did not provide precise, measurable, or time-specific treatment goals, despite this being emphasised by WorkCover. Research also acknowledges a poor understanding that psychological factors play in patients' clinical presentation. They were also unclear about the assessment of psychological factors. As a profession, physiotherapists' understanding of pain has expanded a great deal, especially in terms of the psychological component. However, I believe to overcome this, we as physios may achieve most benefits when interacting with WorkCover patients if the psychological status was formally assessed and communicated with WorkCover, as this has been found to be a significant factor when returning to work. We also propose that some physiotherapists may need to enhance their communication practices between physiotherapists and insurers, despite this already being outlined by WorkCover.
Thank you for joining us today. Join us on our next instalment of Physio TV, where we will interview Taryn Jones about her insight into the matter.